So hey guys, my name is Rishabh Singh, a first year medical student from Eastern Medical College and Hospital, Comella. Welcome to my channel. If you are new here, so please go and subscribe to my YouTube channel. I try to provide you some educational video related to MBBS. I hope you will gain or acquire something new at the end of it. If you like, don't forget to subscribe, like and comment below. So hi guys, today my topic is ECG. Before starting the topic, if you are new to the channel, go hit the bell icon and subscribe to my YouTube channel, like, comment and share. Today's topic is ECG. What is ECG? ECG is electrocardiogram. It is the graphic record of combined total potential changes in heart occurring in various phases of cardiac cycle is called ECG. Or it is the recording of electrical changes of heart in each cardiac cycle from surface of the body is called ECG. This is the definition of ECG. Electrocardiogram is the record. Electrocardiography is the instrument ECG machine. So basically ECG is recorded by the help of ECG machine. Now the uses of ECG. ECG is useful in determining and diagnosis the following: heart rate, heart rhythm, abnormal electrical conduction, poor blood flow to the heart muscle, ischemia, heart attack, coronary artery diseases, hypertrophy of heart chambers. Now what is ECG leads? ECG is recorded by placing series of electrodes on the surface of body. These electrodes are called ECG leads and are connected to the ECG machine. ECG is recorded in 12 leads which are classified into two categories: unipolar leads and bipolar leads. Now the method of recording. There is a direct method, that is experimental animal, and indirect method in which there is unipolar and bipolar. In unipolar, augmented AVR, AVL, AVF and additional chest lead V1, V2, V3, V4, V5, V6. Coming to unipolar limb leads, they are also called augmented limb leads. Active electrodes is connected to one of the leads. Unipolar limb leads are of three types: AVR, AVL and AVF. These three leads together called unipolar limb leads. AVR lead. Active electrodes is from right arm. It is the AVR lead. AVL lead. Active electrodes is from left arm. It is AVL lead. AVF lead. Active electrodes is from left leg, that is foot. Unipolar chest leads are V1, V2, V3, V4, V5, V6. V1, it is placed in the right fourth intercostal space at the right border of the sternum. V2, in left fourth intercostal space at the left border of sternum. V3, at the midpoint of V2 and V4. Now what is V4? V4 is at the left fifth intercostal space at mid clavicular line. So between V4 and V2, V3 is placed at its midpoint. V5 at left fifth intercostal space at the anterior axillary line. V6 at the left fifth intercostal space at the mid axillary line. So these are the locations of chest lead. As you can see the diagram, the position of different unipolar chest lead from V1 to V6. Now moving to another topic, that is Ethiopian triangle. It is a quadrilateral triangle drawn arbitrarily around the area of the heart. So basically Ethiopian is known as the father of electrocardiography because He only suggested the method of ECG. Enthoven is basically a scientist. On the name of scientist, Enthoven triangle is named, and he is also regarded as father of electrocardiography. Now we are moving to bipolar limb leads. Bipolar limb leads are known as standard limb leads. Bipolar limb leads are of three types: lead 1, lead 2, and lead 3. Lead 1 obtained by connecting right arm and left arm. Right arm is connected to negative terminal of the instrument and left arm is connected to positive terminal of instrument. Lead 2 obtained by connecting right arm and left leg. Right arm is connected to negative terminal of the instrument, left leg is connected to positive terminal of the instrument. Lead 3 obtained by connecting left arm and the left leg. Left arm is connected by negative terminal of the instrument. Left leg is connected by positive terminal of the instrument. As you all can see in the diagram, lead 1, lead 2, lead 3. These three leads are basically bipolar limb leads, and RA represent right arm, LA represent left arm, and LL represent left leg. So its positive and a positive terminal of electrode is connected to the left arm and its negative terminal of electrode is connected to right arm. However, in case of lead 2, the positive electrode is connected to left leg and the negative electrode is connected to right arm. In case of lead 3, negative electrode is connected to left arm and positive electrode is connected to left leg. So this complete our topic. Coming to Einthoven law. Einthoven is also regarded as the father of electrocardiography or ECG because he is the only scientist who has given the first statement regarding ECG and all about ECG. The law states that if ECG is recorded through standard limb leads, then sum total voltage of QRS in lead 1 and lead 3 is equivalent to lead 2. Sum total voltage of QRS lead 1 plus lead 3 is equal to lead 2. Suppose lead 1 is 3. Lead 3 is plus 2. Then lead 2 will be plus 5. Now what is normal ECG? Normal ECG shows 5 consecutive waves. P, Q, R, S, T. P, R, T is upward deflections. However, Q and S are downward waves. As you can see in the diagram, P, R, Q, S and T. P, Q, R, S and T. This is from P to Q. This is PR interval. From Q to S, it is QRS interval. Because it is Q, it is R, it is S. So it is QRS interval. And this is S. And this represents T wave. So between S and T there is ST segment, and between S and the ending of T there is ST interval. However, between Q and ending of T it is QT interval. So there are many type of segments interval in this. This is a time versus voltage versus time. Now waves. P waves. Duration is 0.1 second. Features. First, upward deflection. It is small, constant, have a rounded pointed to P. Normal P wave indicate impulse originating at SA node, spread over the atria in usual direction, no defect of conduction, strength of the conduction, the masses of the atrial muscle and its nutrition are normal. Normal P wave indicate all these things. Now we'll go to some pathological conditions. Atrial fibrillation, P wave will be absent, completely absent. Atrial hypertrophy, P wave will be large and notched. If P wave is inverted, SA node fails to generate impulse and atrial muscle depolarizes by impulse originating from AV node. As you can see here, if P wave is inverted, SA node fails to generate impulse and atrial muscle depolarizes by impulse originating from AV node. Now, events in the heart during the wave. During the P wave, atrial depolarization occur in the heart. Now coming to Q wave. As soon as impulse arrive at the muscular part of the septum producing the first wave Q wave is due to depolarization of basal portion of interventricular septum. It is small and a negative wave, absent in infant suffering from congenital patency of the septum. So basically, if you will see a condition in which Q wave is absent, then that condition is known as congenital patency of the septum. Prominent Q waves indicate old infraction. Now coming to R wave. R wave is most constant wave having the tallest amplitude. It is the first positive deflection of the ventricle. So it is the first positive deflection of the ventricle. It occurred due to depolarization of apical portion of interventricular septum and apical portion of ventricular muscle. Whenever depolarization will occur in the apical portion of the interventricular septum and apical portion of ventricular muscle, then R wave will occur. Coming to S wave. S is the next downward deflection constant about often conspicuous. S wave is the next downward deflection constant about often conspicuous. It is often due to depolarization of basal portion of ventricular muscle. Now coming to T wave. T wave is last upward deflection. The last wave which we see in the ECG is T wave. It is broad, smoothly rounded. It is caused by the action current due to the contraction of the basal part of the ventricles. It occurs due to the ventricle repolarization. So the event in the heart is ventricular repolarization. It is normally positive because the apex of heart repolarization earlier the base of the heart. In young adult, T wave is very prominent. Old age, it is flattened. Exercise increases the amplitude in a healthy heart. Abnormality of T wave in shape, direction, duration and reaction to exercise in lead 1, lead 2 are the great prognostic significance. Now what is PR interval? The interval between the onset of P wave and the onset of Q wave is called as PR interval. PR interval signify the atrial depolarization and the conduction of impulse through AV node. It shows duration of conduction of the impulse from the SA node to the ventricle through atrial muscle and AV node. P wave represents the atrial depolarization. So P wave, as we all know, it represents the atrial depolarization. Duration of PR interval. Normal duration 0.18 second and vary between 0.12 to 0.20 seconds. If more than 0.20 seconds signify delay in the conduction of impulse from SA node to the ventricle. Usually the delay occurs in the AV node called AV nodal delay. Clinical significance. Variation in the duration of PR interval help in the diagnosis of several cardiac problems such as PR interval is prolonged in the case of bradycardia and first degree of heart block. It is shortened in tachycardia, Wolff-Parkinson-White syndrome. This completes our topic of ECG. Hope you like this video. Subscribe my channel and share my channel. Thank you.